Welcome, this is Dr. Muhammad Haris Masood. So, today we are here with some important MCQs about spine trauma. If you guys have done reading your textbooks, so let's take a quick short exam and recall some important points from the spine trauma. These So let's begin with our first question today. The most common level of cervical spine injury: C1, C2, C5, C6. Yes, the right answer is C5, C6. So in SLIC score, subaxial injury classification score, subaxial injury classification score is about cervical spine and TLIC score is about thoracic spine. So which score favors operative treatment? 2, 3 or greater than 5? So in SLIC score, always remember 5 or greater than 5 is surgical treatment. Anything less than 5 will be observation or medical treatment. Okay, so in our third question, it is asking which is the most unstable cervical spine injury. So the most unstable cervical spine injury is atlanto-occipital dislocation. In question number 4, it is asking what is a chance fracture? Is it hyperextension, axial loading, flexion dislocation or flexion distraction? So a chance fracture is a fracture of thoracic spine with flexion distraction injury. So the answer is flexion distraction. Chance fracture, flexion distraction. Okay, so let's move on to our next page. Best modality for assessing posterior ligamentous complex: MRI or CT scan? So CT scan is for bones and spurs, for any bony anomaly, for fractures, and MRI is for soft tissue, paravertebral tissue, for discs, for posterior ligamentous complex, for other ligaments. So we will go with MRI. In central cord syndrome, which occurs? मतलब the weakness occurs in which segment more than which? Weakness occurs in legs more than arms or in arms more than legs. So in central cord syndrome, arms are affected more than the legs. Which incomplete spinal cord syndrome generally has best prognosis? Whenever incomplete spinal cord syndromes are asked and best prognosis is asked, then you have to put Brown-Séquard syndrome. It has the best prognosis, and the worst prognosis is with the anterior cord syndrome. Anterior cord has worst prognosis and Brown-Séquard has best prognosis. Type 2 odontoid fractures with 7 mm displacement in a 72-year-old patient. Which will be the most appropriate management? Soft collar, hollow west, anterior odontoid screw fixation or posterior C1 C2 fusion? So we will go with posterior C1 C2 fusion. So let's move on to our next page. Okay, the patient has thoracolumbar burst fracture, TLIC score. So TLIC score has 3 components: morphology, neurology and posterior ligamentous complex. Morphology is burst fracture, so we will add 2 marks for burst fracture. Complete spinal cord injury also has 2 numbers. Incomplete spinal cord injury or cauda equina will have 3 numbers, and EL's posterior ligamentous complex is intact, so it has 0. So what will be the TLIC score? Yeah, it's 4. Skyvora. is most commonly seen in elderly, children, or young adults? Yes, Skyvora is most commonly seen in children. What is Skyvora? Skyvora is actually spinal cord injury without radiological evidence. Okay, so let's move to our next question. What is the most common cause of death immediately after cervical spinal cord injury? Is it renal failure, sepsis, or pulmonary complications? So, pulmonary complications is the most common cause of death after cervical spine injury. 6. Okay. So let's pulmonary complications. So Asia grade B spinal cord injury has complete motor and sensory loss, sensory preserved below the level of injury but motor not preserved, motor preserved with muscle strength less than 3, motor preserved with muscle strength greater than 3, or no loss. So Asia grading score has 5 classes: class A, B, C and D. So whenever there is complete motor and sensory loss, it will be class A. Whenever there is grade B spinal cord injury, so grade B will have sensory preserved below the level of injury but motor will not be preserved. So the